Hi, this is Shauna Gunaratne, and we will be talking about MDR and XDR-TB. So MDR-TB, or multi-drug resistant TB, is defined as tuberculosis that is resistant to both INH and rifampin. Rifampin-resistant TB is clinically treated as equivalent to MDR-TB because rifampin is a cornerstone of therapy, and also most of the rifampin-resistant isolates are also resistant to INH. The WHO updated in 2021 their definition of XDR-TB, or extremely drug-resistant TB. XDR-TB is multi-drug resistant TB, so TB that's already resistant to isoniazid and rifampin, that is also resistant to any fluoroquinolone and an additional group A drug, including bedaquiline or linezolid. The CDC updated their definition of pre-XDR-TB, or pre-extremely drug-resistant TB, in 2021. This is defined as multi-drug resistant TB and resistance to any fluoroquinolone or resistance to an injectable aminoglycoside. XDR-TB, as defined by the CDC from a definition from 2021, is MDR-TB and either resistance to any fluoroquinolone and resistance to an injectable aminoglycoside or resistance to bedaquiline and linezolid. Here is again a schematic of the different drugs that we use for tuberculosis. So in terms of treatment strategies for multi-drug resistant TB, we have moved to shorter all-oral regimens. So previously, we used to choose 3 drugs from Group A plus 1 or 2 from Group B plus or minus Group C. However, now we have moved to shorter 6-month regimens that involve B-PAL, so bedaquiline, pritomanid, and linezolid, or B-PALM, bedaquiline, pritomanid, linezolid, and moxifloxacin. And here is a table showing what labs need to be monitored with patients on MDR treatment with B-PAL or B-PALM. There are multiple public health implications for MDR and XDR-TB. These patients generally have lower rates of treatment and increased mortality, and because they have less treatment, there is more potential for ongoing transmission. Luckily, MDR and XDR-TB rates are very low in the United States. Isoniazid resistance rates are low. Only about 681 cases in 2024 were diagnosed, making up 9.1% of all TB cases in the U.S. There were 115 cases of multi-drug resistant TB in the U.S. in 2024, representing 1.5% of all cases, and XDR-TB was diagnosed in 5 cases in 2024. Overall, the rates of MDR-TB is declining globally. 3.2% of new cases were MDR-TB. 16% of previously treated cases were diagnosed as MDR-TB. The highest proportion of MDR-TB cases are found in Russia or the Russian Federation. 50% of the world's MDR-TB cases are in 4 countries: India, which makes up 32% of those cases, China makes up 7.1%, the Philippines makes up another 7.1%, and then Russia, 6.7%. So again, when we're looking at MDR-TB epidemiology in the world from the Global Tuberculosis Report from 2025 from the WHO, you can see again the 4 countries that contribute many of the world's MDR-TB cases: India, China, the Philippines, and Russia. And then when we're looking at the proportion of TB cases and what is diagnosed as MDR-TB, the proportion is highest in Russia and former countries of the USSR. And again, when we're looking at sort of these overlapping syndemics of TB and HIV, or TB, HIV, and MDR, or rifampin-resistant TB, we can see, unfortunately here, this box where the red, yellow, and blue overlap are countries which have high rates of TB, TB and HIV, and MDR-TB. When we talk about extremely drug-resistant TB, the first case was diagnosed in South Africa, and again, it's more prevalent in countries in the former USSR.